Hi everyone, welcome back to my channel HNE Live. I'm Dr. Cindy Wang, and today I want to talk about ways to impress your attending when you're signing out with them or just overall interacting with your attending. When you're first starting on residency, it's really hard to know how to impress your attending. And honestly, in pathology residency, you apply to fellowships 2 years in advance. You need to make very good impressions with your attendings earlier on so you could develop a rapport and get good letters of recommendation. And now that I'm 2 months away from being attending myself, and certainly these will be things that would impress me if a resident was able to do all of these things for me. Okay, the most important thing you can do to impress your attending would be to come to sign out completely prepared. Okay, maybe not completely, that's asking of a little too much, but prepared. So what I mean by this is coming to sign out, having your cases being previewed, having looked up pertinent history. So this kind of requires that while you're previewing to go into Epic or whatever medical charts that your hospital use and look up histories that is important for this diagnosis that we're working on. I'm not telling you to go look through a deep dive and give me the complete history of this patient, but things are important. Like for example, if this is a biopsy for a colonoscopy, it'd be nice to know a screening colonoscopy, or if this is for a mass that they found on radiology, or if this is someone who has GI bleeding. All of these things matter, and coming with that information is one of the most important things. So other than pertinent history, another really important thing is, as pathologists, we all like to clinically correlate, right? So it would be nice if you were able to look into the chart and see what the endoscopy showed. For example, once again, since I'm a GI pathologist, I want to go back to colonoscopies. If they did a colonoscopy, I would like you to know, or at least be able to tell me, how many polyps they see and how many polyps did they biopsy, or what they saw, if the colon's completely normal or the colon was basically ravaged with inflammation. Whatever the pertinent findings in the endoscopy report, I would like to know while we're signing out. Of course, this kind of depends based on the attending. Some attendings want to know nothing. Some attendings want to know absolutely no history, no imaging, no nothing. Don't tell them anything as sign out. They want to look at it blind. But I think for most people, I could say most pathologists would like to know a little something, and that would be the pertinent histories and pertinent imaging if there was any. The third most important thing when coming to sign out would be having previewed the cases you brought to sign out. So the expectation generally varies depending on what level you are, but if you're watching this video, most likely you are PGY1. And honestly, I don't really care, and most attendings wouldn't care if you are first year to come have looked at it and be like, I think this is abnormal and I think this is okay, and or just say, admit it, I have no idea what I'm looking at, and that's okay, especially if it's a very challenging case to start with. Those are the top 3. Other things you could think about when interacting with your attending during sign out is to come with questions, especially if while you're previewing, you had no idea what something was. If it was a very complicated cancer resection and you just don't know what type of cancer it is, it's always good to come with questions. Be like, well, do you think is this cancer because of certain features? And even if you're completely off, like way off base, at least as attendings, we will think, oh, you've considered this when you previewed, and this is a great teaching moment because now we know you don't know the entity, and it's a very good time to slow down and teach you what it is. Cherry on top would be if you came and brought the special stains that was ordered, the IHCs that was ordered. You keep the cases all very well in order, and it's just easy for the attending to pick up a slide, put it down, pick up a slide, and move on. And as well as while they're doing that, for you to narrate what slides they're seeing. If you're able to narrate, so for example, I pick up the first slide, you're like, this is the margin, and I pick up the fourth slide, it's like, oh, this is represent section of the tumor. Or I'll pick up slide number 10, and then you'll tell me this is blah blah blah. It helps attending so much because they don't have to stop their flow of slides to look at the gross description or to look up history or anything pertinent. So all of these things that you do to make it easy as for the attending to pick up a slide and look, and pick up a slide and look and look and look, and without disrupting an order, the smoother that is, the smoother the sign out is, the more impressed your attending would be. So other than sign out, ways you can impress your attending would be to write them as complete of a report as you can before you send it to the attending. So what I mean by this is make sure you have the proper proper titles and the procedure, and then the diagnosis as the attending has dictated to you. And also to make sure a history is written in, and make sure you go and correct any issues with the growth description. Biggest thing and the cherry on top for this would be if you were able to write these reports like the style that an attending writes. One of the biggest things a resident suffers is from the different styles each attending likes their reports. It is great if you can write the report to the same style as the attending so they don't have to go in and change the report too much. Basically, the easier you make your attending's life, the more they like you and the more they're impressed by you. So for example, some attendings like to say negative for carcinoma, or some attendings will just write no tumor. And if you do it exchanged, the attending will then have to go into your report, delete what you wrote, and then rewrite what they like. So in that sense, it's like, well, why bother writing a report anyway if you're going to make the extra work? But that's what I'm saying. Like, make sure you write it the style your attending likes it. And if you have no idea how your attending likes to write the reports, a very quick trick is to go into your PowerPath, CoPath, whatever system you're using for pathology, and then go up and search past reports that were signed out by this attending and to look up similar diagnosis. So that way you'll know how they like to write it, and then you could write it in a similar way. Now that you've done sign out and you've done the report writing, another big thing a lot of attendings really care about is the follow-up. So the follow-up is basically cases that cannot be signed out right away and need something done to it. It could be cases that needs more IHC workup, or cases that need to be shown to another attending. So for example, if you get a case and there is colon and the GI attending is like, oh yeah, I know how to sign out colon, but then it came also with a gynae resection that doesn't have metastatic colon cancer, then most likely the GI attending will be like, can you show gyne to make sure that there's nothing in the gynae part that would be worth mentioning? Or it will be a case that is a very challenging cancer case and be like, okay, can you take this case and show around the GI department and see what they think? So then that is up to you as a resident to take that case and show it around. And if the attending asks you to do it, just make sure to do it. Don't wait on it, and don't wait until the next day at sign out the attending come and ask you, by the way, did you show that case around? You're like, no. Yeah, don't do that. So make sure to do timely follow-up. If attending had ordered IHCs, try to find it and bring it to sign out the next time. Or anything the attending sort of asks you to do, try to do it in a timely manner. Other things attending might ask you to do in terms of follow-up will be to go back to the gross room. For example, it's not enough lymph nodes were submitted, then you'll have to go back to the gross room and submit more lymph nodes. Or it could be a simple thing as you didn't gross it, someone else grossed the specimen, and attending was reading the gross description and was very confused. So they might ask you as a resident to go talk to the PA or other resident or whoever grossed that specimen to clarify what they wrote. And simple things like that. Just if you just follow up in a timely manner and have it resolved by the time you see the attending next for sign out, it just looks so good on you. I can't do a video about how to impress your attending without talking about communication skills. It is always good to try to do first thing in the morning, see with your attending, hey, when would you like to sign out? Sometimes attending will tell you, I would like to sign out at say 10 every morning for this whole week. Or some attending be like, I'm sorry, my week's schedule is crazy. I have to sign out at different times throughout the day, but just always make sure to check with them if you don't know when sign out is, to shoot your attending an email or a text message to be like, hey, when do you want to sign out this morning? Other things that's considered good communication skills is you as a resident anticipate a ton of work. Like, you know, a lot of cases are going to come out because histology was backed up, and then you got this huge dump of a case or cases, and it's good to let your attending know at the beginning of the day, be like, hey, today's going to be busy because I got a lot of cases. By doing that, if you, for example, take a little longer to preview because the day just, wow, there's so many cases, it's always good to let your attending know, I might not be able to finish previewing all these cases by the time you wanted to sign out. And then your attending can then tell you, be like, oh, okay, let's push sign out till later, or let's look at the stuff you have done now, and then you go back and preview to others, and we'll then do another round of sign out in the afternoon. It's always to have this kind of good communication, and it is better than to show up at sign out, be like, by the way, there's a lot of cases, and I only managed to preview half. At that point, I guess it depends on attending. Some attendings will be very chill about it, be like, okay, let's just look at these all together. Or some attendings, why do you bother coming to sign out if you didn't have the cases ready previewed? And because then it's not really your education anymore if you haven't seen it before and had your own independent thought. That also is attendant dependent, but just having good communication with your attending, letting them know how much is happening in one day, and just letting them know your schedule. For example, if you need to go for a doctor's appointment, let your attending know, so then that they could be like, oh, okay, let's, sign out a little earlier so you could finish a little earlier and you can make it to your doctor's appointment. But basically anything, just always, it's better to let your attending know beforehand and then to basically beg for forgiveness. This is one of the few times where I feel like asking for permission is better than begging for forgiveness. The last important thing about having good communication skills is don't hide any cases from your attending. If you got so many cases and you don't want your attending to have the impression that you're a slow previewer or whatever, or you didn't want them to know that you didn't preview all the cases and then you hold on to the cases and you don't show them that day, it's better to come to sign out without previewing those cases than to hide the cases and, hold them at your desk until you're ready. Like, for example, it's everyone always stresses it's good to preview the cases before bringing it to attending, but if you get so many cases and you hoard half of it and be like, okay, I'm just going to preview it later and I'm going to sign out this half now, and then you keep doing that, then at the end of the week you have this mountain of cases and no attending is going to be happy about that. So just don't hide cases from your attending. Like I said, good communication skills, let your attending know what's happening. And then last thing about how to impress your attending would be in the aspect of your grossing. As a pathology resident, you'll be doing the bulk of cancer resection cases. It's always good if you were the grosser and then you sign out that case with your attending and that gross description was like on point, or the cassette submission was just the perfect amount. It's very impressive and attendings will notice. Don't want it to be this situation where your attending has no idea what they're looking at. Like either your gross description was wrong or the sections you submitted was inappropriate. So to prevent stuff like this happening, it's always good if you're getting a complicated case to just talk to your attending before you start cutting. Be like, hey, I got this really complicated cancer resection. Can you help me with the gross? Not in the sense that your attending will do the cutting for you, but in the sense that your attending should come and walk you through what they think is important about the specimens, important margins, what sections to take to best represent this complicated case. So it's always good to ask for help, if not from your attending, from a PA or from a senior resident, and to never cut before you know what you're doing, before you have a plan. It's better to ask than to beg for forgiveness later, because grossing a complicated resection or just any resection case in general where it actually really matters to the patient, or anything, is if you screw up the specimen, it is sure, you could say, oh, I'm so sorry I messed it up, but then that's forever messed up for that patient, for that clinician. It just looks bad on you, it looks bad on your attending, it looks bad for the whole department. But specific things you could do when you're grossing would be to take good gross photos of the thing intact, also of the thing in section, especially the section with the tumor in it, and in that way you could show depth of invasion or how close it is to margins or anything like that. And once again, always have a formulated plan in your head about how you want to gross this before you start cutting, because once you start cutting and you mess up, it's really GG. Anyways, so I think these are a bunch of tips that I think is very, very useful. And if something you start doing earlier on in your residency just becomes second nature, and I'm sure this will make very good, very, very good first impressions. And hopefully this will, get you good recommendation letters when times comes for your, not even just for your fellowship application or even for a job. All of these good impressions leads to strong recommendation letters. And this is why I've made this video, and I hope these tips have been very helpful or will be very helpful. And as always, if you enjoy my content and enjoy watching my channel, please like and subscribe and leave comments down below. And I will see everyone next time. Bye!